World Health Organization Chief Scientist Soumya Swaminathan on Thursday said that young and healthy people may have to wait till 2022 to get the COVID-19 vaccine. She said by 2021 there will be at least one safe and effective vaccine. She indicated that despite the many vaccine trials being undertaken, speedy mass shots were unlikely and organising who would be given access first in the event of a safe vaccine being discovered was still being worked on. Swaminathan also stressed that health workers and those at highest risk should be prioritised. Swaminathan also warned against complacency about the virus death rate, saying with the increasing number of cases, mortality would also rise. Mortality increases always lag behind increasing cases by a couple of weeks. We shouldn't be complacent that death rates are coming down, she said. There are around 40 different coronavirus vaccines in clinical trials, including one being developed by the University of Oxford that is already in an advanced stage of testing. The virus spreads easily and the majority of the world's population is still vulnerable to it. A vaccine would provide some protection by training people's immune systems to fight the virus so they should not become sick. Research is happening at breakneck speed. About 240 vaccines are in early development, with 40 in clinical trials and 9 already in the final stage of testing on thousands of people. Trials of the Oxford vaccine show it can trigger an immune response, and a deal has been signed with AstraZeneca to supply 100 million doses in the UK alone. The first human trial data back in May indicated the first 8 patients taking part in a US study all produced antibodies that could neutralize the virus. A trial using viral proteins to develop an immune response is underway. A group in China showed a vaccine was safe and led to protective antibodies being made. It is being made available to the Chinese military. Other completely new approaches to vaccine development are in human trials. However, no one knows how effective any of these vaccines will be. A vaccine would normally take years, if not decades, to develop. Researchers hope to achieve the same amount of work in only a few months. Most experts think a vaccine is likely to become widely available by mid-2021, about 12 to 18 months after the new virus, known officially as SARS-CoV-2, first emerged. That would be a huge scientific feat, and there are no guarantees it will work. But scientists are optimistic that if trials are successful, then a small number of people, such as healthcare workers, may be vaccinated before the end of this year. It is worth noting that 4 coronaviruses already circulate in human beings. They cause common cold symptoms and we don't have vaccines for any of them. It will almost inevitably be less successful in older people because aged immune systems do not respond as well to immunization. We see this with the annual flu jab. It may be possible to overcome this by either giving multiple doses or giving it alongside a chemical called an adjuvant that gives the immune system a boost. If a vaccine is developed, then there will be a limited supply, at least initially, so it will be important to prioritize. Healthcare workers who come into contact with COVID-19 patients would top the list. The disease is most deadly in older people, so there would be a priority if the vaccine was effective in this age group. The UK has also said other people considered to be at high risk, potentially included those with some conditions or from certain ethnicities, may be prioritised. Meanwhile, the Union Health Ministry on Thursday said the country's doubling time of COVID-19 cases has sharply increased to 70.4 days from 25.5 days in mid-August, which is nearly thrice the time being taken earlier. This indicates a substantial fall in the daily new cases and the consequent increase in time taken to double the total cases, the ministry tweeted. News Desk, Pravasi Insight.